I was on the streets, living in my car. I mean, I had nothing. I was cleaning up in the bathrooms and the showers of the parks and stuff. Oh, it was, I don't even like to talk about it because it's so ugly.
But after I became homeless, I didn't know what I was gonna do because I didn't have anywhere to go and I didn't want to be with the people I was with anymore.
When you're on the streets, it's a lifestyle that you wouldn't want to wish on nobody because you don't really have a life.
This is a horrible thing to know that in this country today now that there are people that are out here in the streets that are made to suffer. And I just count myself blessed that I'm able to have a place that I can lay my head.
There are nearly 10,000 homeless in San Diego County, with nearly 30% of them suffering from a mental illness. They come from all walks of life, gender, culture, and socioeconomic backgrounds. Homelessness and mental illness don't discriminate.
I don't think people understand really the fact that schizophrenia is like any other illness, like diabetes or cancer or cardiovascular diseases.
We don't know all the causes of mental illness, so we do know that it affects about 1 in 4 individuals at any given time of the year. And we know that about 5 to 6% of Americans can get a serious mental illness.
Programs like ours help folks get off the street, get them the treatment that they need for their mental health, give them the medications that they need to help manage that mental health, teach them the skills that they need.
And we know that these homeless folks they're suffering. And as a community, we want to get them off the streets and into housing, and supportive housing does that for our community.
They have taken such good care of me. From the day I walked into that door, they were there for me no matter what. I was struggling with anxiety. I mean, really bad anxiety.
And then they see me blossoming and clean and start going to school and getting a GED. And I'm in the computers now, and I'm all that about, my life is blooming. And impact is one of the biggest things it ever has. That was my door opener.
There is hope through supportive housing, a county-wide program which offers San Diego's homeless with mental illness affordable housing and wraparound services to get them off the streets. Once in the program and according to their readiness, homeless individuals choose where they want to live, ranging from transitional housing to independent living and other options too. The main goal is permanent supportive housing.
I've been supervising the homeless outreach team for the San Diego Police Department for about 10 years. And this is, so we just go out every day and do this with the homeless mentally ill.
You know, he's disconnected from his supports and his funding, and we're here to help him get reconnected.
If they're in the police car and they're going to the hospital a lot, or they're going to the hospital a lot, then they become priorities for us. Right? So we try to stop that from happening.
Getting the chronically homeless immediate resources and off the streets. That's what the San Diego Police Department's homeless outreach team does every day. The HOT team works closely with all of the local mental health service providers and the San Diego's County Behavioral Health Services.
You know, I'm not just a degenerate. You know, I'm a professional woman who's homeless. I'm homeless because I was one paycheck away. So I told her, I said, I challenge you. How many paychecks away are you from homelessness?
We only really deal with the chronically homeless guys, people that are out that are visible on the street, more than a year homeless, usually tied up with substance abuse and mental illness.
The HOT team's mental health experts are trained to work with the chronically homeless population. The priority are the individuals suffering from chronic diseases, which can make the situation on the streets much more serious.
So when you are afflicted with severe mental illness, you don't have the same screens that the general population would have. And what I mean by screens is emotional, mental, and cognitive screens to be able to use your good judgment.
Our services are targeted for the folks that have really had a hard time engaging in traditional mental health services, meaning that they don't have the skills to navigate what it takes to show up at a clinic, what it takes to talk to a doctor and take medications that are prescribed and to follow up with counseling. And
besides immediate resources, the goal is to get the homeless into transitional and permanent housing. The San Diego County's Behavioral Health Services Supportive Housing Program is leading the efforts. There is an array of housing options for those who are homeless, whether it's a transitional youth, adult, or older adult.
We start from when we, have that first contact with the individual coming, whether it be out of, a crisis house, a hospital, or even, the jail system, of first getting them on medications so it can manage their symptoms.
The sooner we are able to intervene with a person around mental illness, the better outcomes that we would have.
These folks have been disconnected from the communities. As human beings, I feel that we need to be connected to the community, feel part of the community. When we don't, we feel alone. We feel depressed. We feel like, nobody cares. And I think that feeds into a lot of the symptoms that folks with, severe mental illness have.
Start with housing, housing first, and then provide some of the basic care, support, food, clothing, hope, providing them some hope, and basically over time being a consistent, friendly provider and being supportive. Help them take medications, encourage medications if it's needed.
Mental health experts know housing is critical to a person's stability before recovery can begin. There is hope for the thousands forced to live on the streets. These people are our brothers, sisters, parents, sons, and daughters. As for Becky Jo, she's still on the streets, hoping to find a place of her own soon.
I grew up in Rancho San Diego. It's kind of a small town in Spring Valley. I went to school there. I lived there with my family.
As a young child, Salam Abraham and her family moved from Ethiopia to San Diego. Years later, Salam's mental illness became full-blown at 16, about 3 years ago. Her family has been supportive, but there were many times they didn't know how to help Salam.
My mother, I drove her crazy. We recently was talking about it, and she said that she hated her life then when I was sick. She didn't understand what was wrong with me. My brother didn't understand what was wrong with me. We would go to different psychiatrists that were far away from my house, and I wouldn't talk to them.
She wasn't acting herself. She was hallucinating. She would just, they told me that she would like say people are after her, or after them. Yeah, that's about it. And then my brother ended up just, calling the police for help, and they took her in.
I believe that the government was watching me. I believe there was cameras in the vents in my house, and I thought there was I couldn't go outside. I was too scared to go outside because I thought there was people out there who was trying to hurt me.
Mental experts say the first visible signs of mental illness typically happen during the adolescent years. This was the case with Salam, and while she lives with her mother, Salam is at risk of becoming homeless. There's that possibility she can end up on the streets due to her illness.
When I was taken to the ambulance, they took me to Bayview. I stayed there a couple months, and I transferred to Paradise Valley. I was checked into Paradise Valley twice because they released me, but I wasn't healed. And from there I went to Alpine, and that's when I began my recovery.
She experiences symptoms of schizophrenia, which are mostly in remission at this point. She had was experiencing some hallucinations. Her mood and her affects were flat or non-responsive at certain times when we first started. And we start building coping skills, which for Salam are kind of exercising, like the swimming and the walking, but she also likes to write. So
Hearing voices, paranoia, hyperactivity, or sleeping all day long, or not eating, or not bathing. So I'm talking about real severe conditions, which these are the conditions that contribute to homelessness.
To help manage her mental illness and keep her from becoming homeless, Salam's case manager and team of mental experts provide wraparound services 24/7. The program is also helping the teenager look for housing as a preventative measure.
Wellness checkup to see how her week was going, and if she needs help with anything as far as school-wise, or she have a goal of maybe volunteering, or gain a part-time employment, or possibly move into one of our housings.
Hi, good afternoon.
Hi, how are you?
Good.
I'm Larnie from the Catalyst program, and Salam. I have Salam here, and she's interested in viewing the house. So if it's okay, if you could just show her, around. As a team, we discuss what's ideal for the client, whether they're able to be more independent, how's their independent living skills, their decision making, I would say, and also what kind of goals they have at that time, what goals they're working on, and what kind of assistance or services they need.
So when she enrolled with services, what we do, we have a whole week of activities that we do with her, like the assessment. We sit down and figure out what kind of goals she wants to work with, where she is like mentally, how she understands what symptoms are affecting her and where it's holding her back. And then we kind of develop a plan about how we go about learning coping skills to get through some of those obstacles, and introduce her to the entire team.
Salam has come so far, she is making a full recovery. Besides her family, Salam credits the supportive housing program for her good health.
Now she's sweet, she's caring, she wants to help everyone. Totally different. Now that you look back, you can tell something was wrong, because, I don't know, she's a different person now.
With certainty, Salam feels if it weren't for the program, she could be homeless.
Probably on the streets, because I drove my mom really crazy when I was sick, and if there wasn't a cure for what I had, I'd probably be homeless.
Jennifer Reed ended up homeless in downtown San Diego. It happened about 8 months ago. Jennifer believes the stress of school contributed to her mental illness.
I ended up having a nervous breakdown, and I called 211, that's listed, and 211 helped guide me for about 2 weeks. They would tell me everywhere to go get some food. They would tell you if there's some room for the shelter. Trying to find food was kind of hard, because there's a way, like the Salvation Army serves dinner at 5, where the police says you have to come back at 9 o'clock to go to bed, and then you have to get back up at 5 o'clock to start your day.
Another major issue is the lack of affordable housing for individuals who are homeless in general, but especially for people with serious mental illness, because often they cannot work. They cannot be productive citizens. Now, they can if they have housing, if they have services that are wrapping around their needs.
There's lots of folks out there who have a serious mental illness, and they're going to work and they're maintaining their home. It's the lack of support and a lack of treatment. And when your symptoms are out of control and you're unable to go to work, and you're unable to take care of yourself, that's the situation that causes the homelessness.
Today, Jennifer is off the streets and in temporary housing thanks to the San Diego County's Behavioral Health Services Supportive Housing Program, which works at getting the most vulnerable homeless individuals into housing. Jennifer is in the very beginning stage of her recovery.
We have different housing options from short-term to transitional housing to permanent supportive housing. And individuals go through these different levels according to their readiness in terms of sustaining housing and in terms of their clinical stability and their ability to sustain housing.
As Jennifer gets used to her temporary housing, she's also working a few hours a day at the Rachel Center in downtown San Diego, a women's shelter program.
People are more invested in the recovery process if they have a consistent, stable place, and a place that they own and have ownership of and they have control over. Because keep in mind, one of the things that, having control of things is that seed that starts the recovery process. Because when I have control, I can make choices about my goals and my future.
So we provide a wraparound services 24 hours, 7 days a week, voluntary, and it includes mental health, it includes mental health services, it includes medication management, it includes case management, it includes care coordination and linkage to whatever this individual needs, and of course includes permanent supportive housing.
Jennifer is learning how to manage her social and mental needs, and she's getting help with her recovery. A mental health experts team will be there round the clock to help Jennifer every step of the way.
This project has been so good. I'm starting to really like it. To getting used to them. This is my first week, yeah. I've been sleeping good the last 2 days. And they even have mental health here. So they're gonna make an appointment for me with the doctor.
So I wanted to get some help. I really did. I knew I was in trouble. I was going homeless. I was a blackout drunk. I couldn't read or write, couldn't get a job. My destiny was death.
Patrick Muncio was homeless on the streets of San Diego for an entire decade. He suffers from schizophrenia and alcoholism, a common situation for many on the streets.
I was on my last day going out into the streets, and I got a call from Impact. It was some young lady, and she called me up. She said, "Pat, I'd like to interview you. You'd be a perfect candidate for us." I said, "You know what? You couldn't have called me at a better time."
Patrick is in the final stages of his recovery. He has his own place, he's getting his GED, and learning how to read and write, and has plans to find a job. Bob Redeker is doing very well these days, thanks to his caseworker and the supportive housing program. Bob clearly remembers living with an abusive stepfather and noticed the signs of his mental illness in his teens.
Towards my teen years, I started having these thoughts of hurting myself. And when I was 16, they put me into CMH for a little while, and then they transferred me over to like an adolescent unit. I had to take medications. I wasn't too great on taking medications. But I finally realized after so many years that if I took my medications, I would be okay.
For the first time in more than 20 years, Bob is getting the wraparound services he needs to help him fully recover. He knows about his mental illness and what he has to do to stay healthy. He now has his own place too.
Take too long waiting on the train that'll take me home. So I'm singing the funkiest song just until another one comes along. I was diagnosed in November of 2000 with schizophrenic, bipolar, suicidal, homicidal.
Dallas came to us. He was at County Mental Health. He had been brought in for being chronically homeless, being on the streets, not having any treatment for his mental health. So he came in with some severe symptoms.
As a young man, Dallas proudly served in the U.S. Air Force, but in later years he couldn't manage his symptoms and ended up on the streets near downtown San Diego. But so much has changed for the better. Dallas now has his own apartment and is now in the final stages of his recovery.
It's been a real tumultuous issue because the first 5 years after the diagnosis, the doctors that were interviewing me, that were giving me my treatment, were so far, I felt I was so far gone, they need to notify people of my situation. And I felt that was a really horrible thing.
Not only did he go without food, water, and shelter, he went out without medication. It would be comparable to, you and I, if we had diabetes and went untreated for years and needed that medication.
They don't have the skills to navigate what it takes to show up at a clinic, what it takes to talk to a doctor and take medications that are prescribed and to follow up with counseling. And these folks, their challenges is that they can't get organized enough to do that. And so we're doing the outreach to them on the streets to help connect with them and offer them basic things that will help them get off the streets.
I think that one of the major issues is the illness themselves. The diagnosis that they have, whether it's schizophrenia or bipolar disorder or depression. Sometimes they have what we call co-occurring disorders, which is mental illness and substance use or substance dependence. So being homeless and having mental illness just adds to the stress of being homeless.
Breaking the cycle of homelessness is challenging, but thanks to the county's supportive housing program, people can make progress once they have permanent housing and wraparound services. The county closely works with the City of San Diego and housing developers to provide supportive housing.
He's been educated about his mental health, so now he has great insight and he knows what it takes. We've educated him on symptom management, medication management, life skills, as far as how to take care of your home, how to clean, how to wash your dishes.
In 13 years, I have my own key to my own door, to my own place. And it's wonderful, it really is.
It's been many years of struggling for Patrick, Bob, and Dallas with their mental illness and being homeless. But now all three are in the final stages of their recovery. They are off the streets and each has their own place.
And I'm grateful for this place. This is a beautiful home. I haven't told you yet about Reed San Diego, but I'm grateful for Reed and my tutors and the support group I have there. I'm glad I have not did any drugs. Another thing is that I'm clean and I'm above ground today.
Such a blessed position. There are so many thousands of people just right outside of here that don't have that blessing. I'm looking to see if there are women and children that are out here in the streets, which is such a horrible thing.
I see my life is back, but it has a little smudge on it. But I see the life is coming back, and I'm kind of happy because for 30 to 60 days we'll be in that hotel.
But they were took me there, took care of me, picked me up, took me home, made sure I had everything I needed. They were just like my new family.
People with psychiatric illnesses can work, they can go to school, they can hold full-time jobs, they can be professionals, they can be politicians, and they can be psychiatrists and doctors and nurses.
Supportive services and housing would reduce community cost, and research is showing that. The numbers are in, and we're showing significant reductions in things like emergency room visits, first responder visits, law enforcement involvement, jail costs. In some cases, the numbers are like an 80% reduction. Two steps forward, one step back, 2 steps forward, 1 step back, and that's the way we make progress in recovery.
It's not just a key to an apartment, it's a key to the happiness that they've always been waiting for.
The program is working. It shows that a stable home with social and mental health services means positive results, including a 70% increase in recovery. 42% can work after 6 months. There's a 55% drop in medical payments and a 32% decrease in emergency services. The goal of supportive housing is to help homeless individuals with mental illness gain stability and live more productive lives. Home is where recovery begins.